Hello, my name is Jesse Dickinson, and it is May 6th, 2026. And today I'm going to talk about heart failure. Here's my notes that I'm going to use to help keep me on track. We'll start with the definition of heart failure. And to put it most basically, it's inadequate blood flow. It's the heart's inability to pump adequate blood flow to the body for perfusion. So the heart gets to a point where it's weak, and the blood flow that it provides doesn't give the nutrients, oxygen that the cells of the and organs need to adequately perfuse. This can result from structural or functional changes to the heart, or it can be caused by congenital things that didn't necessarily change, but became more of a problem over time. As far as the classification goes, heart failure is typically talked about in terms of left-sided heart failure or right-sided heart failure. Left-sided heart failure typically leads to like a pulmonary congestion, and right-sided heart failure leads to peripheral congestion, edema in the legs and stuff like that. They use a classification from 1 through 4. Class 1 heart failure being pretty minor and minimal effect on daily activities. Class 4 being severe late stage or advanced heart failure that has a direct, significant impact on everyday life and ability to do tasks. The etiology of heart failure can be caused from multiple things, and oftentimes they all kind of come in conjunction, kind of a constellation of signs and symptoms. Oftentimes, coronary artery disease, specifically an MI, will injure the heart to a degree that the heart's weakened and unable to pump adequately, and it's not always immediately apparent. So, like, somebody can have an MI, they can have injury to the heart muscle, and they can recover some at least, and then the heart failure kind of progresses with time, and they get to a point where they start to really notice the signs and symptoms more. Hypertension can also lead to heart failure. The heart struggles to pump against systemic high blood pressure, and that over time stresses the heart to the point where it becomes weak, or the heart becomes very thick, and the walls of the ventricle become very stiff, so it becomes harder for the ventricles to fill up adequately. Therefore, if it doesn't fill up adequately, you don't get what's called preload, which means you don't get a good blood flow when it does squeeze. And this you can see, like, in things like dilated cardiomyopathy, the opposite problem happens, where the heart muscle is really weak and boggy. What syndrome does it fall in? It's a cardiovascular disease. It falls under cardiovascular syndromes, and also closely related to that is cardiorenal syndrome. So one of the most sensitive organs to lack of blood flow is the kidneys. And so you can get an acute kidney injury or renal failure from chronic hypoperfusion via heart failure. And oftentimes the kidneys also, if they're failing, they don't adequately remove fluid from the body, so that backs up and causes the heart to be stressed. And so renal failure can exacerbate heart failure, and heart failure can exacerbate renal failure. So they have this, like, kind of bidirectional interplay between them. Some of the clinical manifestations that we see in heart failure, we'll see, like, dyspnea on exertion, fatigue, shortness of breath, portal hypertension, and right-sided heart failure, because since the right ventricle and or atrium have a difficulty emptying blood from the systemic circulation coming back to the heart, it backs up and can cause heart failure or liver failure, maybe a portal hypertension. Um, Sorry, excuse me. Um, so dyspnea, hypotension, low blood pressure. Oftentimes, we'll see a low blood pressure in people that have heart failure. As far as tests goes, the most important test is an echocardiogram. That's pretty much the gold standard. It will have a reduced EF, specifically an EF less than 40% is enough to classify you as having heart failure. Um, the echo also will look for valves because valve abnormalities and problems can also be secondary to or cause heart failure if you have like aortic stenosis, for example, the left ventricle's inability to adequately vent or empty the ventricle can um, cause it to uh, exacerbate the heart failure. Other tests we can do are things like a blood test called BNP. If the BNP is elevated, it's an indication of cardiac stress. And so an elevated BNP can indicate heart failure and stretch. Chest X-ray will show us like an enlarged heart, like in cardiomyopathy situation. And those are some key tests, and those some of the expected results. One differential diagnosis we can do is COPD. COPD can have some of the same signs and symptoms like dyspnea, dyspneic exertion, orthopnea, even with both of those, adventitious lung sounds, and there's also some crossover with risk factors. For example, smoking, high blood pressure, diabetes, all kind of are risk factors for hypertension and COPD. And so, one way you can really differentiate heart failure and COPD is the echocardiogram. If the person has a healthy heart, then you know that the lung sounds, it's respiratory in nature. They're whatever orthopnea they have or dyspnea. Um, and some of the labs we mentioned, like a BNP, somebody with COPD won't necessarily have any cardiac enzymes elevated. Other possible complications are arrhythmias like atrial fibrillation. Uh, Due to the hypoperfusion, renal failure is a really common one we see, or acute kidney injuries, cardiogenic shock, where the blood pressure gets so low that every organ is not getting adequate blood flow, and they need to go on medication to increase the blood flow. Um, and as I've mentioned before, another complication is liver failure due to portal hypertension from the right side, being unable to offload the pressure of systemic circulation. Heart failure is one of those things that is managed. It is not cured. You can't. It's like not like you can do a surgery to reverse it or medication to fix it or cure it. Once you have heart failure, you the goal is to minimize symptoms and optimize quality of life, and also prevent further damage. So, depending on the severity, some people may just be on medications, but in severe cases, somebody may need mechanical support in terms of a left ventricular assist device. Um, but that is what we do. We manage it. We don't are not able to cure it. And thank you for watching.